Today, we live in a country where you can purchase almost anything from anywhere, making government policies protecting insurance companies from interstate competition almost indefensible. Lawmakers would be laughed out of office if they insisted that you are only allowed to buy cell phones, foods, or any other products from merchants in their state in which you lived. All sorts of financial products are routinely acquired without state border providing an impenetrable barrier, such as life insurance, stocks and bonds, bank accounts, and even credit cards. So why should medical plans be any different? Hello, my name is Tyler Heinen, and today I'll be talking about the interstate sale of private health insurance within the United States. There is no good reason to deny freedom of choice to Americans when it comes to buying health insurance. Yet licensing rules in virtually every state effectively prevent individual residents from shopping for health plans in another state. Consequently, there is no national market for health insurance. There is only independent state markets, mainly dominated by huge companies that can get away with offering lower quality insurance at even higher premiums. When I was in junior high, I remember going on a hike with my friends before we went to one of those famous junior high dances. The day was full of fun and games, but little did I know it would introduce me to something that would affect me for the next 5 years of my life. The day after, I woke up just like any other day. However, that day, I could not place any weight whatsoever on my right ankle, and I had no idea what I did to cause it. Fast forward to my sophomore year of high school, and the same thing happens after football or baseball practice, games, work, and even after just standing for long periods of time. We tried ice baths, painkillers, anything anybody or any doctor could think of, but nothing was working, and I was always left crawling on the floor the next day. My PCP didn't know what was going on. The x-rays, MRIs, CAT scans all showed up normal without anything substantial showing what was causing it. My PCP wanted to send me to an orthopedic doctor in Nebraska. However, our insurance only covered doctors in Kansas unless it was an emergency situation. This forced me to go to another doctor in Topeka. The doctor ultimately didn't know what was going on either and passed me to a doctor in Kansas City. At this point, I had been through roughly 7 x-rays, 3 MRIs, 3 doctors, 2 CAT scans, and nothing to show for it. When it seemed like all was lost, I finally made my appointment with Dr. Horton at KU Med. It was then, just after one more x-ray and one more doctor visit, we found that I actually had a piece of bone that had separated and then reattached to the ankle, fusing it together. We finally had an answer to the problems I had been experiencing for the past 5 years. The moral of this story is that in the end, my experience might have been a lot better and quicker if our insurance didn't restrict us to the borders of our own state and allowed me to go to a closer facility that was higher end than Topeka up in Nebraska. Alright, so now we're going to talk about the current situation in the United States. In 1944, the Supreme Court actually gave the power of insurance regulation to the federal government. However, in 1945, via the Federal McCarran-Ferguson Act, the federal government pushed off this power to state governments. Until March 2010, there was no federal law that in general either allowed or prohibited cross-border purchasing of health insurance. The only laws that regulate health insurance policies that are fully insured and sold throughout the small employer and individual insurance markets in all 50 states were those of the state governments. The federal reform law, especially Section 1333 of the Affordable Care Act, took place in 2010 and became in full effect in January of 2016, is the only provision within the federal government that allows interstate sale of health insurance. Section 1333 permits states to form healthcare choice interstate compacts to allow insurers to sell policies in any state participating in the compact. Two or more states may enter into these compacts under which one or more insurance plans may be offered in the such states within the compact. These compacts must be approved by the Health and Human Services Department of the federal government. The idea of states allowing free market sales across state lines outside of federal regulation is an untested proposition. This was especially true during the transition period to the effective dates of the federal reforms specified out in Section 1333 of the Affordable Care Act. This map shows states' position on interstate health insurance within their state. As you can see, there are only 6 states highlighted in green that have enacted laws that allow interstate health insurance within their borders. Rhode Island was the first state to pass an out-of-state purchasing law in 2008. This law created a regional health insurance compact similar to the design later authorized by the Affordable Care Act. Wyoming was the first state in 2010 to enact a signed law based on the free market model, but also included a multi-state compact related to the federal government reform. Georgia signed their law in 2011 and became the first state with a law drafted and passed since the Federal Affordable Care Act became law. Kentucky signed their law in 2012, with Maine signing theirs in 2011, but not being effective until January 1st of 2014. Oklahoma was the last of the 6 states to sign their law, which went into effect on May 31st of 2017. Washington actually adopted a study order in 2008, but no binding or further action was taken by their legislature. In Arizona, a bill passed the House and Senate in 2011, but was vetoed by the governor and did not become law. Now that we know a little bit of the background history and the fact that we are actually set up to allow interstate health insurance, the main question still remains on why nobody is jumping on the boat and testing out the waters. Well, the main reason is negotiation. Negotiation plays a huge factor in the sale of insurance across the borders. For example, hospitals are more likely to give better deals to insurance companies that are operated within their own state rather than giving good deals to out-of-state insurance companies. This hurts the cost-saving aspect of interstate health insurance that this was supposed to aid with. Another thing that there is a substantial amount of uncertainty on how the markets of health insurance will react by allowing interstate health insurance. So what's in it for us? With interstate competition, consumers would more likely be able to find a policy that fits their budget and their style of life, giving more people access to affordable insurance. This could also allow for bigger risk pools that could lower the cost of health insurance in general, and also provide bigger networks for hospitals that span upon multiple states. Today we are constantly playing a game of red light, green light with our insurance companies when it comes to being allowed to do certain procedures or see certain doctors. So imagine a health system with limited to no boundaries and where you are not constantly playing a game of red light and green light with your insurance companies. Imagine you are not told to go to a specific facility within certain borders where you would be covered. Rather, you could go anywhere to any hospital close to you, whether in your state or not. Imagine a bigger risk pool and networks that would help lower costs and give you better access to facilities that are closer to you. The battle is on. It is on us as healthcare officials to take on the battle of private health insurance. It is on us to be advocates for bigger networks and less borders within the healthcare system. It is on us to build bridges between legislatures, insurance companies, and healthcare facilities. We live in a world where you can buy material online with relatively no boundaries or red lights stopping you. So why should healthcare be any different?